My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to DO or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
Hi, my name is Madli, and I'm a third-year medical student, and you are listening to Do or Do Not. Today, I will be interviewing Dr. Ariel Nassim, a sports medicine physician at Nassim Medical in New York. Dr. Nassim graduated from New York College of Osteopathic Medicine and completed his residency at the Icahn School of Medicine at Mount Sinai Beth Israel. He also completed a sports medicine fellowship at Drexel University College of Medicine. In addition to his regular practice, Dr. Nassim has worked with several professional athletes at various sports events, including the U.S. Open and Pan American Games. He is even scheduled to be on Team USA's medical staff for the upcoming 2021 Olympics. We hope you enjoy this episode. Okay, so thank you, Dr. Nassim, for coming on today. I'm going to start by asking you to kind of describe what your normal day looks like.
So my normal day starts around 6:30 a.m. Get out of bed, usually out of the house by 7 a.m. I pray every morning actually at home. So I usually take a few minutes in prayer every morning before I get started. And I will go straight to at least one hospital where I usually admit patients from our practice. It will range anywhere from 2 or 3 patients up to 5, 6 patients. Occasionally I'll have a second hospital to go to as well. And then usually get to the office by 9 a.m. to start office hours. I'll see patients till about 5:30 or 6 in the afternoon. And then about an hour of phone calls or now virtual telemedicine visits, and then wrap up. And I usually get out of the office by about 7:30, 8 o'clock and get back home.
Okay. And when and how did you become interested in medicine? And what kind of led you to decide you wanted to become a doctor?
Yeah, so my father's an internist, so I always admired what he did serving our community. You know, he had a very important role for a lot of his patients who turned to him during tough times. I was always an athlete growing up as well, so I kind of took what I saw in my father serving the community and kind of helping from that and being someone's physician and my love of sports and kind of figured out how to combine them to go into primary care sports medicine. So now I'm able to do both ends. I deal with the sports population and with my sports medicine background, working with some professional teams, the Olympic team, and also serving as a general practitioner for a lot of patients in my community, people I've grown up friendly with and family with. And it's been very rewarding to kind of go into it and kind of follow my dad's footsteps in that sense.
Yeah, and where did your father go to medical school?
So he actually lived in Venezuela for about 30 years. He was born in Iran, moved at about 5 or 6 years old to Venezuela. So he ended up doing his medical school down there. It was only after he married my mother and he finished his internship down there is when they decided they wanted to move to America. And then they came out here. So he did most of his schooling down in Venezuela where his family was.
Oh, it's very interesting. Did you ever consider applying to a foreign medical school like him?
I did. You know, for him, it was a little different. His was not a foreign medical school. His was an actual medical school where he grew up. So for him, it wasn't really going abroad. It was staying abroad. For me, you know, I did apply. You know, I applied to some of the Caribbean schools. I was very close to going to a school called Technion in Israel. And, you know, at the end of the day, I had the opportunity to go to NICOM, or now it's NYITCOM in Old Westbury. So it ended up working out for me. And I really did weigh out all the pros and cons. You know, I think nowadays, when you look at MDs versus DOs, many of the people that are aware of the differences realize there's not much difference. And I had to do a lot of my own due diligence. My father wasn't very familiar with osteopaths at that point, even though he was in practice for a very long time. So for him, it was a learning process, but we both very quickly realized I can do anything I was planning to do, going 15 minutes away from home to NICOM rather than, you know, going abroad and having to come back and, you know, always having that foreign medical grad sticker on my resume. So thankfully, I've been able to map out everything I wanted to do in my career early on. And then I was able to weigh it out, looking at the difference of going to an osteopathic school versus an allopathic school. And I realized very quickly that I can get wherever I wanted to go just by going nearby at an osteopathic school. And it's worked out great. I mean, I really got everything I looked for plus some by going to NICOM in Old Westbury.
Mm-hmm. And since there aren't any osteopathic physicians in your family, how did you first hear about the DO career path?
Yeah, it's some friends that I had that went through it a few years ahead of me, and I saw where they were going. Many of them ended up in allopathic residencies. A lot of them were getting fellowships, and I realized it was a medical school so close to home that I did my own homework. I did my own research. I went and visited the school. It was getting so much more competitive going to the allopathic schools in New York, where I live, that I had to look at some of the alternatives. Thankfully, I had a good option so close by, but it was a learning curve. Unfortunately, I think there's a lot of misunderstanding about the osteopathic profession still, even though we have so many people. When you talk about the physician to the president is an osteopath currently. So there's people at all levels of society in the osteopathic world who are doing great things and can get really any position they want. I'm sure if we look, I don't know, but I'm sure we've had surgeon generals who are osteopaths. It's the kind of thing that it became very clear very quickly as I did my research that osteopathic was the way to go for me when I was comparing it to some of the other options I had available at the time. So unfortunately, I did poorly on my verbal section of the MCAT. And I remember that was really my limiting step. I had the GPA, I had a lot of the other credentials to look at some of the MD schools in New York. But when it came to interview season, my verbal section was the one thing really weighing me back. And what happened is that I quickly had to realize that, I take a year off, I can retake tests to try to improve my resume. But that was a year that could have potentially been, quote unquote, wasted if I wasn't going to do something very productive with it. And really, my goal was, I knew what I wanted. I wanted to do an internal medicine residency. I wanted to do a sports fellowship. I knew that very early on. Once I realized that, an osteopathic school so close by can get me to exactly those places I wanted to get to, I realized, why waste the year? Let's get to it. And I knew I had a competitive enough application for NICOM. So I was able to get right in, and thankfully the rest is history.
Yeah. And then how did you like NICOM? Can you just talk a little bit about your experience there? For instance, like any special extracurricular activities, any research that you did, any interesting mentors or colleagues that you met while you were there?
Yeah. So, it's like many of the osteopathic schools, it's a very big student population. We had about 300 students in our class when we started. Probably ended with about 270 at the end of the fourth year. I happened to go into it from the very beginning into a problem-based learning curriculum. So there was an application process within the school to all the applicants that got accepted to get acceptance into a smaller group. It was about 30 or 32 students that got accepted to a problem-based learning curriculum that was really small group based. We still had access to all the lectures everyone else would go to, but we had exams on different timelines. It was essentially its own school within the school. That allowed us to develop a lot of close relationships with all of our friends in that program. A lot of close mentoring I had with some of the mentors I got there, some of the doctors that we had in that program. You just develop much more of a personal relationship with them rather than going into the lecture halls. And it's sometimes much more impersonal there, and the inability to sometimes get in closer to teachers. So I love that part of it. Those were the first 2 years. And then really the third and fourth year was me really creating a lot of my own curriculum in terms of where I wanted to be. I knew which hospitals I wanted to look at for residency. So I had the opportunity to really do some of my rotations at those hospitals. Not all of them were osteopathic hospitals. Certainly my internal medicine rotations, my surgery rotations were done at, a big university hospital nearby. And I think that also helped in terms of me being able to put better things on paper, better recommendations coming after the fact when I was applying for my residency programs. You ask about extracurriculars. Probably one of the more proud things we had was we were back-to-back intramural championships for basketball at NYIT. So we actually beat some of the undergrad teams and some of the former Division II basketball players they had on their teams when the medical school team went up against them in the intramurals. The dean of the school at the time was very happy that we were able to bring home intramural championships in basketball for him.
Oh, that definitely sounds like a lot of fun. And then coming down to applying for residency, how did you ultimately choose your program?
So for me, it was a combination of things. One was maintaining a very high level of training in medicine. And then secondly was also where I wanted to live. I realized that, you're spending 3 years of your life somewhere. You better make sure that it's somewhere you want to be. I had never lived in New York City. I currently live in the suburbs. I grew up in the suburbs about 30 minutes outside of Manhattan. But I always wanted to experience living in New York City. And really, I had plenty of good options there. Beth Israel was one that I thought, even from college, I was eyeing it. I had friends that had done residency there, went on to do some very good things. I was lucky enough, it was my first choice, and I got it. And it's part of the Mount Sinai health system. So it really came with some strong backing in terms of a big academic center behind it, but it was also a community hospital feel to it. Again, it was a big residency. We probably had 50 residents our first year, 15 of which were prelims. But, I had some great relationships I built there. And I had a fantastic program director in Daniel Steinberg, who really, he never had a resident that wanted to do sports medicine. And he opened up a lot of doors for me, or really I should took down a lot of barriers for me, being that, I guess I proved myself in my first year of internship, and he says he would support me in whatever I had to do to get the best fellowship. He was kind of instrumental in pointing me in certain directions, even though he had never experienced a resident going through this to get to sports medicine. He really was able to find contacts and people he knew in the industry that could mentor me during those years of residency and really help me in terms of getting the experiences I need to get to the best fellowship possible.
And then during your residency, was your experience, or do you feel that your experience was any different because you were a DO?
Not at all. I think, people need to be aware of what they want to accomplish in life. If someone wants to do orthopedics at Mass General, I don't know how many osteopaths they're taking at Mass General for orthopedics. So that's why you got to know the end product that you're looking to get to. And I knew what I wanted. I knew that Beth Israel took osteopaths regularly at the time. We probably had some of our best residents were osteopathic my year. We probably had close to 10 or 15 osteopathic residents at least, if not more. So they were aware of what osteopathic students and their training in medical school entailed. They understood what a COMLEX score should be. They were able to compare it to USMLE because they've had experience with it. So I say if someone wants a specific specialty, they want to end up in a certain hospital for certain programs, you got to look and see, have they experienced osteopaths before? Have they taken osteopath residents before? And if they have something to compare to. They'll also understand what to expect from that. And, very often nothing different from an allopathic applicant. In my case, wanting to do sports medicine, I had, if anything, an upper hand because of our manual training. We're more used to putting hands on a patient. When, musculoskeletal medicine, sports medicine, orthopedics, you have to use your hands much more. I knew where I wanted to get to, and I made sure that going to an osteopathic program was not going to hinder me. If anything, I think it helped me throughout my training because of what I looked to do. But again, I think, anyone considering osteopathic schools needs to keep that in mind. You got to have the end in sight. It's not only about, I want to become a doctor. Everyone wants to be a doctor, but there's a lot of different routes to getting there. I say you have to know where the finish line is. And then once you know what the finish line looks like, then you work backwards to say, what does it take to get to each step? And you'll realize that, in many, many specialties, osteopathic schools is not going to hinder you at all. But for, that's small percentage of specialties at specific hospitals. If someone's life goal is to do certain things, they have to look into it and see, is that going to hinder me? Again, I would say for 98 to 99% of things people want to do in medicine, it's not going to hinder them at all. It's just something to keep in mind. And again, having the end in sight helps you because you can work backwards and just make sure that going to the osteopathic programs is not going to hinder you in that process, that the programs you're looking at know the osteopathic candidates, what they've done for them in the past, where they've gone on to after going through those programs. And that will all help if you have that in mind.
Yeah, I think that's excellent advice to kind of set your ultimate goal and then kind of work backwards. I think that's a great way to go about it. And then can you talk a little bit more about your fellowship, both the application process and the fellowship experience itself, and also just discuss where you went for your fellowship?
Sure. So the application process to residency, you mean?
To your fellowship program.
Fellowship. So, fellowship was a little tougher because while I wanted to stay in New York for my residency, there were plenty of programs in the area in New York where I lived. When it came to sports medicine fellowships, and again, specifically talking about primary care sports medicine, there was really not very many options. There was probably a handful in New York, many of which I didn't look at just based on the type of program I wanted to be at, where there was some professional sports coverage, high Division I collegiate athletic experience. So I really opened up and looked across the country at different programs. I ended up in my fourth year, I did an away rotation at Icahn, which was, one of the premier programs in the country for sports medicine. There was my mentor's mentor was Thomas Trojan. So he was the program director up at Icahn. Interestingly, a few months after my rotation, he ended up changing over jobs and he went to Drexel University in Philadelphia. So I did apply across the country. I spent 4 weeks really touring the country, going to a lot of the different programs. I probably interviewed at about 15 or 16 programs. I ranked about 12 or 13 of them. But at the end of the day, it came down to, the mentor I wanted to train under was at Drexel in Philadelphia. Thankfully, I got where I wanted to get to. The nice thing about it was also living in a fantastic city. I happened to get married about 3 weeks before residency was finished up. So I say it was about a 1-year honeymoon where we moved out to Philadelphia away from our families, had a 1 year just ourselves in a vibrant city, amazing food. And so we really got to enjoy a new place together, whereas neither of us had ever lived outside of New York prior to that. The fellowship itself was incredible. I got everything I wanted. I trained with some incredible orthopedic surgeons, incredible primary care sports medicine docs, had tons of experiences at the professional level, at the collegiate level, and a lot of musculoskeletal ultrasound training, which I'm still using today. I say residency and fellowship is just laying the foundation and it's teaching you how to do things, but it's really up to you to go out and do it on your own after fellowship. So I say they kind of gave me my wings, and then I've been able to thankfully fly after that.
Mm-hmm. And how was your experience looking for a job after fellowship?
The negotiation was hard. I had to interview with my mom and my dad, my mom runs my dad's practice. And they've never hired anyone prior to me as another doc to join the practice. I actually, during fellowship, I considered looking at other jobs back home and some of the big hospital systems. And one piece of advice my program director gave me at the time, he asked me, he said, what do you want to do 5 years from now? And I said, 5 years from now, I'd love to be in my dad's practice, working with him and kind of expanding on the sports stuff and adding that to the practice. And so he says, why waste your time going somewhere else? And, that resonated because you get caught up during residency and fellowship, seeing what a lot of other people are doing. And, a lot of times you go to fancy health systems or hospital systems or fancy practices with a lot of equipment. It went back to that end in sight, and you got to really keep things in perspective. So for me, do I go and interview at some fancy practices that have all these professional sports they're covering and things like that? Or do I go and join my father, which I ultimately want to be working with him in the long term anyway? So he put that into perspective. He says, why go waste 2 or 3 years right now doing something else just to get those experiences or the professional sports and all that, because you're going to start from scratch once you go to your dad's practice and you change over. And again, I don't think everyone's as fortunate to know where they want to end up 5 years down. It was something I want to do. I wanted to come in and work with him. I wanted to, expand on his practice and, long term be able to work together. The interesting thing is, some of those practices I looked at during fellowship to join ended up losing a lot of these contracts they have. And, going into my dad's practice, I had this thought of, okay, so I'll practice clinically. I'm going to be a community doc. I'll do internal medicine, sports medicine. And, it may just not happen. I won't have as many of those big teams. But within 1 year of joining my dad's practice, I had 2 universities that I was their team physician for. I was invited to join the US Open tennis championships as one of their doctors. And since then, I'm working with the Brooklyn Nets organization. I'm the team physician for their Long Island G League team. I've worked with the U.S. Olympic Committee at the Pan American Games. I should be going. I'm invited to be a team physician at the Tokyo Olympics this coming summer. There was a lot of these things that opened up that if you asked me when I first joined my dad, I would have said I probably wouldn't have those opportunities. Anyone who goes into sports medicine also realizes these opportunities come and they go. A lot of what's happened with these team coverages has become a money game, and there's a lot in terms of who's going to pay the team the most to give them coverage. So I've learned to appreciate my time working with all of them. I'm honored to work with a lot of these organizations, but these also don't last. So also when you're joining a practice, whether it's hospital-based, private practice-based, just realize a lot of the fancy things that comes with it may not always be there. So you got to make sure the environment you're working in is the environment you want to work in. So a lot can change in practices and hospital systems. But I found being a part of my dad's practice, I have all the freedom in the world to do whatever I want, take 3 weeks off to go to Tokyo. I dictate my own schedule. I dictate everything about what I do in my practice. And none of that would have been possible if I was employed by another group. So looking back, it's probably one of the best pieces of advice I've got from my program director to say, what do you want to be doing 5 years from now? So don't waste your time doing other things. Just work on building that up.
So that's such a unique opportunity, getting to work with all these professional athletes, both on teams and, at all these Olympic Games and the Pan American Games. Can you share some of the experiences working with these professionals and how your kind of day-to-day would look like with these teams compared to what you're doing now?
Yeah, I mean, it sounds fancy, it sounds exciting, which it is, and I I absolutely love taking care of some of the professional athletes and the Olympic level athletes. But the funniest thing is that something a lot of people don't realize: once you're in an exam room with someone, it comes back to the same doctor-patient relationship. And some of the I was out in Colorado Springs at the Olympic training facility, and I remember there was someone who came in. He wasn't feeling well from the morning time. I had no idea who he was. I walked in. I was told it's a male athlete who's not feeling well. I took care of him, spent about 30 minutes evaluating him, diagnosed him, got him started on treatment. And it was only after he left, about 30 minutes later, I had people coming up to me saying, I can't believe that was him. And I said, who was it? And I realized he was a gold medalist at the previous Olympics. He's a 4-time world champion. I mean, you hear all these things, and I'd say he was one of the most down-to-earth people I've ever met. So it's really, it changes, because what people see from the outside is all this glam and all the glory. But once you're taking care of them, it really still comes down to that doctor-patient relationship. And I find that it's very important to keep that distinction. You can't be a fan when you're taking care of them. I've learned you be a fan when you're watching on TV, and when you're taking care of them, it's a job. It's really a duty to kind of be there as their physician. So sometimes you could potentially compromise the care you're providing if you think too much about who they are as professionals. So they're really my patient when I'm taking care of them, and I try to keep that in mind anytime I'm having an interaction with them.
You mentioned earlier that you kind of knew that you wanted to do sports medicine early, but I'm also curious if you can go back and with what you know now, if you could choose a different specialty, would you choose anything else?
Well, I don't know about my whole life. It was probably closer to my junior year of college and I realized what I really wanted to do. But looking back at it, I don't know if I would really change much. I've been blessed. I have parents who are very supportive throughout the entire process. We had plenty of luck, which at the end of the day, we put in the hard work, but it comes down to, the blessings and the luck that we get. And I would say I got lucky along the way to be able to do a lot of the things that I did. And I had some very, very supportive people around me who made it easy to kind of do well. I don't know if I would have changed anything. Thank God I absolutely love what I do right now. I love the people I'm able to work with. I think it's looking back at it, being able to do medicine and then adding the musculoskeletal component of it, going to NICOM and getting some manual training, which I'm able to use in my day to day sports practice. These are all things looking backwards, everything kind of fit right. Or maybe I'm just looking at it like it fit right. You can always look back and say, oh, I wish this, I wish that. I can't believe I didn't do well on my MCAT and imagine what school I could have gone to. But looking back at it, I've been able to get to exactly where I wanted to get to and be able to do some very cool things and work with some really incredible organizations and people. And, I hope to be able to do it for a long time. I don't know if I would have changed anything. I think I've had some great experiences at NICOM. I've had great residency experience. My fellowship was incredible. Since that time, 4.5, 5 years since, things have been, thank God, very, very good to me. And I hope to be able to continue to do that. And I'm hope to continue to train the next generation too. I just had an osteopathic student here that's finishing up his 4th year. We were just talking about whether he would join our practice or not. So I'm hoping we can kind of mentor that next generation, help them in the process. And I told him the same thing I'm telling you right now is like, I told him, look at the end in sight, see what you want to do ultimately. And, now you get to put the pieces in place to get to that point.
Yeah. And then one thing that makes DOs unique is that we are trained in osteopathic manipulative medicine. Are you able to use this in your sports medicine practice?
Yeah, so I think it's just like anything else, a tool. There are some practices that every day they're using OMT. In my case, I had the training. I probably did not use it much at all during my residency, given I went to an allopathic program. But interestingly enough, I had an MD mentor in fellowship, and he went on his own and he learned osteopathy and he practiced OMT during our clinics. So this is an MD who realized the benefit of manual medicine and when appropriate, he would use it. I think the biggest problem with implementing it is the time it takes. So I don't use it as much as I would like to. I find that I use it more when it comes to family and friends after hours or at home or when my wife's neck is hurting her. I have the skills to be able to do it for someone. But what happens is it takes time unless the clinic is built in a way time wise that you could spend that extra time to do the manual medicine. It just interrupts patient flow too much. So when I find a patient who I really do think it would benefit, I'll put them into the schedule appropriately. I'll have them come back and then we'll work on that. If I have a cancellation, very often I'll just tell the patient to stay and I'll work on them for 15 or 20 minutes. So I say it's skills that I love having because I can offer it when it's appropriate. Do I use it a lot? Probably not. I think a lot of that is the limitation of timing and insurance reimbursement. A lot of times insurance don't necessarily reimburse for the time you're spending doing the OMT. At the end of the day, it comes down to finances as well. If you spend 30 minutes with someone treating them and insurance doesn't recognize that you've done anything for them during 30 minutes, that also becomes problematic. I certainly have had patients that do very well with it when I think it's appropriate. And I'd say I sprinkle it into my practice. It's definitely not something on a daily basis, but perhaps on a weekly basis or a biweekly basis, I'll have a patient that I perform OMT on.
Okay. And switching gears a little bit, I just want to ask a little bit more personal questions, if that's all right. Starting with, did you take out any loans to go to medical school?
So I took out, there was a few federally subsidized loans that I was able to defer interest on for the 4 years. So that made up a small portion of it. But other than that, I was very blessed that I had parents who were willing to support me through medical school. I remember that day in my fourth year, at the end of the fourth year of med school, where everyone was opening their envelopes with some tremendous debt that they realized they were inheriting at the end of those 4 years. Thankfully, I did not have that. I was very, very blessed that I had parents who were able and willing to help me along the process. And I guess I'm also paying it back now, working in the practice and helping them along the way as well. I didn't have that. And, I keep going back to I was blessed. I was blessed because I didn't need to worry about picking a specialty to be able to pay back some big financial debts. I saw some of my colleagues who would have, $400,000 in debt between undergrad and medical school, and sometimes even more than that. And some of them were choosing certain specialties because they said they needed to pay back the debt. And they wouldn't be able to do that if they picked pediatrics or family practice or some of the primary care specialties, which I think is unfortunate. I think medicine has it somewhat backwards with how they reimburse. Some of the most important work is being done at the primary care level. We have a lot of subspecialists and we don't have a lot of good generalists. And I'm hoping the health system in our country can change a bit to start valuing good primary care more than, procedures, more than diagnostics, where a lot of the subspecialists are making more of the money, essentially. I think as soon as the money shifts towards prevention, towards primary care, you're going to see way more people going into those specialties. Hopefully people not having to make specialty decisions based on debt that they took on just to go to medical school.
Absolutely. Do you have any advice for current medical students regarding the cost of their education?
You'll be okay. It's easy to get very scared. It's very easy to get caught up in that. Looking back at, I went to an undergrad that cost about $2,000 a year. So I finished in my 4 years of undergrad with $8,000 total in tuition that I had spent. And that was a city school. And looking back at it is one of the best decisions I made. My brother, who went into real estate, went to NYU, and my parents also supported him, but they ended up spending close to $50,000 or $60,000 a year for him to go for undergrad. And, on the whole, spent probably 200,000 plus on his 4 years of undergrad, whereas for me it was 8 or 10 grand. That's one thing I think people need to keep in mind is, a lot. This goes back to what sounds nice or the big diploma on the wall with an Ivy League school. Very often, it doesn't get you much further along. I have plenty of students I talk to who have the opportunity to go to a city school with honors and a full scholarship, and it's really a very selective program, or they go to an Ivy League school and have to pay $50,000, $60,000, $70,000 a year. And I ask them, I said, what do you want to do? And very often they say, they give me an answer of something they can do out of both programs. And very often those honors programs at city schools or state schools, you can shine even more. You stand out even more at those programs. And that's something I don't know if our listeners are in that position as much, but if I can talk to some high school seniors or freshmen in college, I would tell them that, what matters is not so much the diploma on the wall for most things. It matters is in terms of where do you want to get to and what's going to get you there. And I know in New York, the city programs, the state programs are excellent educationally. So to go and spend multiples of that for your undergrad education, that's somewhere you can cut corners in a sense. Medical school is a little tougher. I don't think people have as much choice. A lot of times these are the few schools I got acceptances to, and even there are some states medical schools that are a fraction of the cost. And if someone were to get into, in our state, downstate medical school, where it's going to be $15,000 or $20,000 a year in tuition rather than 60 for some of the private schools, I would tell them, I would say, go to the state school, cut how much debt you're coming out of medical school with, because it shouldn't affect that downstream decision making, which unfortunately it has to. Some people take on so much debt between undergrad and medical school that they're forced into picking higher paying specialties, whether it is something they want to do or not. And that just adds pressure throughout the whole process, because now they have to do more subspecialization. Now you're pushing off a real job even further down the road. They have to do 3 years of medicine, 3 years of cardiology, and then interventional cardiology, all because they were taking out a lot of debt and they thought that they had to make a certain income to pay that debt back. Obviously, not everyone thinks like that, but I think there's some undertones in the student population this stuff certainly is true. I think people are making a lot of decisions based on how much debt they have or what they think they have to make after they're all out of training. I say limit how much debt you come out of school with. I think it'll help you, it'll make you more comfortable, and the majority of the time you can get to the same exact place whether you went to those schools or you went to a much more expensive private school. I definitely tell people to keep all that in mind when making decisions.
Mm-hmm. How do you obtain a good work-life balance?
Who said I have good work-life balance? I told you I work 7 to 7. I think you have to be able to turn off what's going on. I make sure when I'm off, I'm off. When I get home, I don't take work home with me. I don't, I'll stay in the office late to make sure I get what I need done rather than going home and have things lingering. Go home and try to do office notes from home. I think it's really important when you go home, you have to give your full attention to, your spouse, your significant other, your kids, the people around you, because they deserve it too. My wife has put up with a lot having to, she's at home and I'm out all day. And, we had this discussion the other night, how throughout quarantine, I told her not much has changed for me other than I put on a mask now when I see patients. And for her, a lot more has changed. She can't go to as many places. Restaurants are closed. The kids are home from school more often, Zooming on computers instead of going to school, taking care of them at home more. Things have changed a lot more for her. So when I'm there, I have to make sure to be there. And if I brought my work home with me, if I was constantly doing work from home, that's not fair to anyone around me. Truth is, in medicine, it will never end if we don't want it to end. I can have patients all day, all night, but I have to draw lines, and I make sure to take time off. My weekends, I make sure to take off. I round every morning. So Saturdays and Sundays, I round in the hospital to see our patients. But I make sure that I go early morning, I get out of it, I make sure to get back home. So the majority of my day could be spent with my family because I don't see them as much during the week. And, on the flip side, prior to pandemic coming up, I made sure you got to take time off and we go on vacations and make sure to enjoy some of the better things in life. And it's not all work, no play. You got to make sure to have that balance. But certainly I had to sacrifice, do I work out as much as I used to? Maybe not, but that's my prioritization of, a little less basketball, a little less tennis and more family time because I have to make some of those sacrifices as well. But you need to, especially now with what we understand, physician burnout and things like that. If there isn't that balance, if there isn't that time to turn things off and just enjoy yourself, it does take a toll. We're in a serious industry, especially right now with everything we're seeing. Last night I had a close friend who's a patient of mine who was hospitalized with COVID. That takes a toll. You going to sleep at night, not knowing what's happening with our patients, with our friends, our family. It takes a toll. So it's important to have some of that balance and, laugh and play and enjoy yourself and, just let loose is a very important thing that people need to keep in mind all through training. It's not only when you're in private practice or after your residency or fellowship. This is in medical school, this is in residency, all throughout. That's an important piece of advice I would give is you got to make sure to enjoy yourself, spend time with friends, spend time with family, make it, all through residency. I made sure for my family, Friday night dinner was a very important thing. So no matter what was going on, unless I was actively on a shift in the hospital, I made sure to get home for that family dinner on Friday nights. That was important. That's a big part of what kept me going is that once a week I spent time around the table with my family. Obviously during the week when I had time, I'd spend time with friends. You want to make sure to have those things built in because otherwise life gets busy and you're never going to make the time for it otherwise.
Mm-hmm. Okay, so this might sound a little interesting, but what is your superpower? And what I mean by that is, can you tell us one thing that has made you successful, or one thing about you that has made you successful?
Well, it's good. My mom can tell you very well. She said since I was about 4 years old, I was extremely stubborn. I would pick what I wanted, and wouldn't take no for an answer. At 4 years old, it was about having Coca-Cola in the morning. Thankfully, that habit has changed. I would say the one thing that helped me get to where I am today is the fact that I was very goal oriented. I figured out what I wanted very early, relatively speaking. I had a lot of, as a junior in college, whereas most of my friends still didn't know what they wanted to do third or fourth year of medical school. I knew what I wanted to do and where I wanted to get to very early on, and I was stubborn about doing whatever I had to do to get to that point. And I think goes back to what we spoke about earlier. Have the end in sight. Obviously, the target sometimes changes a little bit, sometimes a lot, but as long as you have something you're trying to get to, it's like driving a car. If I know I need to get to exit 50 of the highway, then can plan what route I want to take. But if you just want to drive a car, you're going to end up very lost at certain points, and you're not really going to end up anywhere. So I'm stubborn, and I go after what I know I want, and that's my superpower, I guess you can say, is that and that allowed me to get to where I want to get to today.
That's an excellent superpower. Who knew stubbornness would be so powerful? All right, so we have a grand finale question for you here, and that is, what is the best piece of advice you've gotten throughout your education that you always think of and would pass on to other students?
So my junior varsity basketball coach had a saying. He says, "If you fail to prepare, you're preparing to fail." And again, he's probably going back, and I don't know how many times I'm going to say this on this podcast, but having that end in sight. If you fail to prepare and you fail to have that ultimate goal in mind, you're preparing to fail along the road. And I've had plenty of friends who switch specialties, and so many things can come along the way between undergrad and medical school and residency and fellowship. And it adds up when you keep changing course, when you keep having road bumps hit and you aren't prepared for them, or you're not necessarily rolling with some of those punches, you end up taking much longer to get to your ultimate goal. So I say prepare early, create a sort of life map for yourself, the 1 year, the 5 year, 10 year, 20 year goals. Obviously, no one does everything exactly as they planned. If I look back 10 years ago, what my life plan was, perhaps it would be different than what I see today. But I had certain goals I wanted to get to. I had certain ideas of what kind of things I wanted to do, experiences I wanted to have. And I think just preparing in advance for some of that helps along the way. There's a saying also that, we plan and God laughs. And that's very true. At the end of the day, we cannot plan everything. But I'm talking about big picture stuff, the type of specialty, the type of practice, the type of experience you want to have. Those sorts of things, you can have big picture goals and say, how can I get there? The process, no one can predict. Things are going to come up. But having that end picture in mind helps you in terms of creating that tapestry of how you're going to try to get there. And then the experience is the most important part. People look at medical school, undergrad, and pre-med and residency as these sometimes miserable experiences. I was so overworked. I wasn't sleeping. I didn't have it. I had some of the best times of my life during training. And it's because I went into it saying it's going to be hard work, and I'm going to have some nights that I don't sleep all that much, and exams that are going to be tough. But when you go into it, that open mind of, this is part of the experience. Working 80-hour weeks in residency is part of the experience. Submerge yourself in some of that. Try to enjoy it as much as you can. And like I said, laugh along the way, create friendships along the way. Those are the things that help you through really demanding work that you're all trying to get into. And I think if you keep that in mind, you really work hard at it, you're going to really see all the fruits of your labor come out of it at the end of it. But really don't forget to enjoy that road, enjoy the process of going through medical school, going through pre-med, all the application processes, going to different places, interviewing with different people. There's something to learn from everyone you meet and everyone you experience along the road. And you never know when those people come back up later in life. Till this day, I'll have people I call from 10 years ago because it happens to be that they're in a certain specialty now. And I had that relationship, and might not have spoken to them, but the fact that I had some interaction, some sort of connection with them years ago, it comes back up. Medicine's a small world. Really, really do your best to enjoy the entire process of applications, going to schools, whether you end up in an osteopathic school or not. I think this whole process of becoming a doctor is really a special experience. It's a special duty that you can have in terms of treating people in this world. I think whoever goes into it should really hold their head up high because they're really doing something noble, and they should always remember that every day of their practice.
Yeah, I think that's a really powerful way to end this interview. Thank you again, Dr. Nassim, for taking the time to talk to me today and for sharing some of your experiences. I know our listeners are excited to hear about it, and I'm sure would love to hear more sometime.
All right. Thank you so much.
Thank you.
Take care. Bye.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tianyu Shea. Thank you guys so much for listening to Do or Do Not.